What a beautiful morning. It's so great to be here at Publix, and it's always great to be in Indian River County. We're great to be here for another great announcement. So we, at the beginning of this month, we're looking for other ways to be able to get vaccines into communities for senior citizens. And so we launched a pilot project with Publix in 3 counties, Citrus, Hernando, and Marion, over 22 different stores. We had a good response from that, so then we've expanded the partnership, and we're now in counties in the Panhandle, in Southwest Florida, Palm Beach, Martin, St. John's, Volusia, Flagler, and so it's been good. So there's been over 242 different stores where folks can go in, get a vaccine, and usually that's within a mile or 2 of their homes, and so that's very convenient, particularly for elderly people. So today, we're happy to be able to announce that we're expanding the Publix program to include 8 Publix pharmacies in Indian River County and 11 Publix pharmacies in St. Lucie County. And so they're going to be offering the vaccine later this week. I believe tomorrow morning you'll be able to go online and sign up for appointments. And it's important to know this is by appointment only. And so get on there, get it. The appointments go very quickly. I mean, I think most people understand we're getting about 266,000 initial doses a week now. We obviously have demand that far outstrips that. So you got to get in early, get those appointments. But that will now bring us up to 261 Publix pharmacies in 20 different counties in Florida that are going to be offering COVID vaccines for senior citizens. And so this is a good progress. It puts it in even more communities. And now we have it from Palm Beach on the east coast of Florida, really all the way up, I believe, into St. John's. And so we've got a lot covered there. We've got a handful of counties on the southwest Florida coast, Panhandle counties, and then as well some on the Nature Coast. So we're going to keep doing that. It is by appointment only, so folks, just please understand that. Publix.com/COVID vaccine. The 2 sign-up windows this week. The first sign-up window is going to be Wednesday morning. So you go on, you'll be able to sign up, you'll be able to make an appointment. Now, there's a lot of people that are trying to sign up at that same time, so just understand that. The second opportunity to sign up will be on Friday morning. It'll be the same deal, same website, and we appreciate Publix for stepping up and doing this. And I think that I've been able to visit probably a dozen Publix over the past few weeks, speaking with folks who are actually getting the shots. And the seniors were very appreciative. They thought it was a good process. Obviously, getting that appointment, you got to be quick on the trigger. But once we're able to do that, I think it works very well. So we'll keep doing that. We are happy to report. The reporting, when someone gets a shot, it still needs to be reported in the system. That takes 24, 48, 72. Sometimes it takes 5 days to get all that in. But we do have reported the first state in the country to reach 1 million seniors reported for shots. And there's no state that's even close to that. We're hundreds of thousands ahead of the next closest state. We've also vaccinated roughly 22% of all 65 and up in the state of Florida, and that is either first, tied for first, or just second in the country with West Virginia, who's done a great job. So we're proud of that. We're proud that we're putting seniors first. As soon as we get more vaccine, there's going to be more seniors that have an opportunity to get it, and we're happy to be able to provide that option for them. We also are now, what you're going to start seeing is you're going to start seeing more and more second doses administered. So when the first came in December, a lot of that was healthcare workers. We have seen them get their second dose, particularly of the Pfizer. But now that we're getting towards the end of January, you're going to start having the booster shot due, particularly for seniors that got the Moderna with the 28 days. So that's really going to start to take hold this week and in the next. So those numbers where you would do 10, 15,000 booster shots a day, those are going to go up dramatically. And so if you're looking at kind of the distributions in Florida, a lot of the distributions that are going to start to go are really those second doses. The first doses we get in, we're doing more than 266,000 a week, and so we've asked for more of those doses. Now that you're having the Moderna and even the Pfizer with some of the seniors, as you saw more seniors get it in early January, second week of January, then you're going to start to see that booster. But we believe that the booster is important, and it's a 2-shot regimen. And so those boosters, if you get a shot at Publix 3 weeks ago, they're getting the booster shot sent to them for you to have that appointment to be able to do it. I know some people are saying, well, just use those shots for something else. People, I think seniors want to make sure they have access to both shots, so we're going to continue to do it. But we're now at over 1 million seniors reported. Because of the lag, we're probably 1.1 or even more in terms of those seniors who've actually received the shot, and we're going to keep going forward. So we appreciate having Publix here. I think that there's been a lot of interest in this. Remember, Wednesday morning and Friday morning, 2 windows to go up and sign up. And Publix is just one thing that we're doing. It's a way to get it in communities. But we have, in conjunction with county health departments, stood up 77 community vaccination sites throughout the state of Florida. Every Florida county, all 67 counties, have at least one place where seniors can go to receive the vaccine. We also have some major sites like Hard Rock Stadium, which does the drive-through test model, and we continue to partner with houses of worship to be able to do that on a Sunday morning when people are going to church. So we're going to continue to do it. We are appreciative of having Publix on board, and we're going to continue to work with folks as we continue to get more vaccines in. So I'm happy to be here, and I want to thank them for their partnership. And with that, take a couple. Yes, sir.
Your reaction to yesterday's announcement from the White House saying that DeSantis only used 50% of their supply? Your reaction to that?
Well, that's disingenuous. We are #1 in the country for doses per capita for the top 10 states, the top 10 most populous states. Florida's now, that's according to CDC data. And then if you look, when I did my press conference yesterday, I explained how these doses work with the second doses coming in. And so if you look, we do first doses, 300,000 plus a week at a minimum. The last 3 weeks, we did 455,000 2 weeks ago. We'll see last week's numbers as it comes in. But we're not going to divert second doses away from seniors. Seniors want it, we're going to do it. So if the implication is you should be giving those doses away to other people, that's not the way the FDA has prescribed it. And so we are absolutely committed to that, and we're going to continue to do it. And as I said, you're going to see those numbers really start to jump. But, if someone is due Moderna 28 days and we get the second dose on day 24, they're going to have the appointment and they're going to get that dose. That's the way it works. But the fact is, if you look of the top 10 most populous states, we're #1 in doses per capita. We are #1 by far with the number of seniors that have been able to be vaccinated. And we have the throughput that if we can get more first doses given to Florida, we would be able to do that much more, that much quickly. And so that is really the #1 thing that we can get help from the federal government on, because we're at the mercy of whatever is sent. So if they send 500,000 first doses instead of 266, I can double the drive-through sites. I can give more to hospitals. I can expand Publix. I mean, we have a lot of Publix stores, but there's a lot more Publix throughout the state of Florida. So the possibilities really are endless, and it's just contingent on getting more of those first doses of the vaccine. But we are going to have second doses for senior citizens. And if the White House is suggesting that we shouldn't be doing that, I think that that's not a good suggestion.
Why are you opposed to the Fed setting up?
What's that?
266,000 doses that you guys got a week. How many of those will be going to Publix? And do you think that that will be impacting the county health departments at all? We're hearing that Palm Beach County, for example, has had some issues with that.
Well, Palm Beach County has 67 Publix that are offering it. So they have a lot of options for their residents. And I think it's just a matter of what's the most easy for folks. I think Palm Beach, they had, when I met with the county mayor and all those county folks, and we told them all the different things that are going on. Obviously, they had things. We told them about Publix. They were like, yeah, bring that here. We think it'll be good because they have so many seniors that live so close to a Publix. 90% of their seniors live within a mile and a half of at least one Publix, and so that's how you're doing it. So out of the 266, Publix is in. Out of the 250 stores, I think they get about 70,000 to spread out over those 250 stores. But, they're doing 50 to 100 shots at each store a day. So they can run through that pretty quickly. And again, whether you get it at a drive-through site, whether you get it at your local Publix, whether you get it there, the important thing is that people are getting shots. And so we have the capacity, if we got more first doses, we could add a lane to a drive-through site. That's very easy to do. You can do more with conjunction with county health. I have hospitals that could do a lot more, and they want to do a lot more. And it's really all contingent. So all this stuff is spread out as best we can to try to cover every place in Florida. Not every place has robust hospital infrastructure in Florida. Some have very good hospital infrastructure. Not every place has a lot of sites, that their county health's doing. Some are doing a lot, others aren't. So we're just making sure that we spread it out so that folks are able to do. What we don't want is to have we want to try to get it so it's convenient to people, and so you have a place to go without having to drive all over God's green earth to be able to get a shot. So that's why Publix, I think, has been helpful in that regard.
What about the Fed setting up FEMA sites?
So the thing is all we need is more doses. I mean, so if they're gonna give us more doses and they want to do that, but I don't think that's going to happen overnight. I think that probably will take a while. And so if it's taking the current doses we have and diverting it to that, I think that's robbing Peter to pay Paul. If you get us more doses, but the thing is I think most governors are saying the same thing too. We have the throughput. You have every place that's doing this can do more. So I think just get more doses. That is really the number one thing, that we're going to be doing. As I went through the numbers yesterday, as of Monday morning, and we're getting shipment yesterday and today, Wednesday. So those numbers are probably populated, but we really, those won't start going until probably Wednesday. But we had about 1.7 million first doses delivered, and we had reported by then 1.25 million administered. But of course, there's a lag in this reporting, so we were probably closer to 1.3 or 4, and then Monday, Tuesday, Wednesday, you would do the rest. So we're pretty much going through the first doses, and I think that's really what you need. Most of the other doses that we had are the second shots that come in, and those go to the places that the first doses were administered. So if you went to the county health department on January 2nd, well, guess what? On January 30th, they're going to have the second dose for you there because that's what the FDA has recommended, and so that's what we're following.
Governor, instead of having these mass distribution things, would you be opposed if counties wanted to have, say, a distribution for people 80 and over, or something like that?
Well, they can. Anyone 65 and over is eligible. We obviously target people that are very elderly in nursing homes and in some of those things, and I think that's fine. We have some hospitals who are doing home visits to some of the folks who may be homebound. We think that's fine as well. So bottom line is, we want everyone 65 and up to get it. Clearly, someone that's 66 probably has more wherewithal to be able to get it than someone that's 86. And so if they want to focus on really elderly people, I think that's totally legitimate.
To the sheriff, the ability for counties to do that, it's obviously going to be 66-year-olds who are more able to go into.
That's not obviously true. We have a whole range of folks. I was there. I was in Fort Myers the other day. There were folks in their 80s that were waiting and thought it was really well. So I don't think that's a fit. Well, right, but I don't think that's fair to say that this is all 66. I think you have a wide variety of folks who've been able to utilize it, and I think it's been I think it's been a good thing.
The ShareCare system for managing the vaccinations.
Excuse me?
Can you speak to ShareCare, the system the state is setting up for managing vaccinations?
You mean to help the counties with appointments and things like that?
We're very frustrated in Indian River County up till now because they aren't able to get on any sort of a waiting list, and they all scramble in the same 2 minutes.
Right. Well, but that's a separate issue. So the question is should you just book people all in advance without knowing what the vaccine schedule is going to be? The problem with that is then people get their appointments canceled, and that people really get frustrated when that happens.
Actual appointments, a reservation system where people can get on a waiting list. Is ShareCare going to help with that situation?
So the counties who had problems reached out, so the state is providing support, so people are using websites to be able to make reservations. We also have some sites that operate by phone. Now that's very difficult to do because you have a lot of people. It's very costly and time consuming to do. So there's been a variety of ways, but I would say with these sites, like Publix has to do it too. There's a crush of people that want to get on, and so they have to throttle it so it goes slower. But that's all designed to be able to let people get through so that you're able to do it. So,
ShareCare have a feature that allows people to get on a waiting list then?
so we've worked with the counties with website support, have provided it. I know a number of them are using it, and it seems to be an improvement from what we were doing before. So we'll keep doing that. I got to run. Thanks. See you guys.